you feel sick, you know it's time to go to the doctor. But if you're struggling, let's say, with depression or behavioral health issues, when do you know the time is right to get help? Montevista Hospital provides a safe environment to do just that.
From Montevista Hospital, we welcome psychiatrist Jamie Syshawn. Jamie, welcome in.
Thank you.
It's great to have you.
Yeah, that was well said there, that, you know, when we have something physically wrong with us or one of our kids, it's a no-brainer. We got to get you to the doctor. There can be a big stigma or a lot of, I don't know, confusion before someone will actually seek treatment for psychological or behavioral issues.
That's true. A lot of people don't even recognize the signs of depression, or they might feel the physical symptoms first and then recognize later, when nothing is wrong after they've seen a doctor, that it is depression. So it's kind of very important that we get the word out there that depression is something that does happen. There are treatments, effective ones. And we can help people.
That stigma around depression slowly but surely seems to be fading away, but there's still a long way to go. Let's talk about this non-invasive treatment that you have. It's called TMS. What was this?
It stands for Transcranial Magnetic Stimulation. It's basically we place a magnet around the area of the brain that we know is less active in patients with depression. It's called the dorsolateral prefrontal cortex.
A what now?
Wow.
It's called the dorsolateral prefrontal cortex. It's right here.
Sure.
It's an area of the brain that's less active in patients that have depression. And basically what the machine does is it kind of stimulates those brain neurons, increases the flow of the conductivity, and sort of brings them back to working order.
This is kind of like low-level laser treatment, but for that area of the brain. That's pretty remarkable.
Yeah.
You're stimulating that area. Is this a very modern procedure? How long has it been around?
It's actually been around for about 20 years.
No kidding.
It's just, it was not really popularized due to the antidepressants, and most patients were taking medications. But now that most patients have side effects from medications or are looking for alternative treatments, it can also be popular in pregnancy and with patients that have failed medications or have significant side effects, it's approved.
Wow.
Can I jump in? Wait, you mentioned popular in pregnancy. Do you mean dealing with postpartum depression, or
both?
What do you mean?
During pregnancy and postpartum period.
So if they don't want to take the medication.
They don't want to take medication.
It's safe to have this procedure during.
Yes.
Or do you call it a procedure or a treatment?
It's a treatment.
It's a treatment.
Interesting. So who are the top candidates for this? Obviously, pregnant women being one of them, but.
Anybody who's failed a trial of antidepressants or not noticed that the medication is helping them enough is a candidate.
So you would suggest this comes after medication, or can this be done in lieu of medication?
It can also be done instead of medication. Most insurances, however, do want patients to try at least one medication.
Of course.
If they have any side effects, though, it would be a reason to try this treatment.
Gotcha.
Yeah, and there often are side effects, aren't there? You know, I would feel a little certain that other people share my concern. Like, how does this feel? I think whenever it comes to a treatment that involves anything on your head, you're thinking this is a very sensitive area. Is this going to be painful for me?
No, actually it's not painful at all. Most patients just feel like a slight tapping sensation on that side of their head. Mild headache can be common. There's a little bit of noise from the machine, although the machine at Montevista is not as loud as an MRI, so it's quieter than an MRI machine. And there's very minimal side effects.
Very interesting. Covered by most insurance, of course, but they want to possibly see you take a medication first to see if that will work for you. I know that you're offering a free consultation for people if they're wondering if they can get more information on something like this.
Yes, you can call the number of Montevista, and we're offering free consultations, and we'll review your records and see. And there are exceptions. And like I said, most patients do respond very well to this treatment. It has a high remission rate for depression.
Wow.
Even with booster sessions, the remission rate is anywhere from 50 to 70%.
Wow.
Which is very high.
Yeah, which is remarkable. It's the first time I'm hearing about it. It's incredible, and I know that's at Montevista.
It is interesting. As I researched it online, a lot of the big facilities across the country are performing this as well. So it's definitely cutting edge. Thank you. Thanks for sharing the info.
Pleasure.
Wow, Montevista Hospital is located on Rochelle Avenue, just south of Flamingo, near Jones.
Absolutely.
Ha ha ha.
Ah.
It's a familiar area, right?
We know that area,
To take advantage of their offer for a free consultation, their phone number and website are up on your screen. Montevista Hospital, proud sponsor of the Morning Blend.